We are wrapping up our series on the importance of not skipping medical care during this pandemic, focusing this morning on heart health. We are joined now by cardiologist Dr. Gaurav Sharma with Rochester Regional Health. Good morning, doctor.
Hi, good morning. How are you?
Good. Thank you for joining us this morning.
Sure, no problem.
One of the things I want to ask you about is, are there patients in need of heart health care that you're finding should have come in earlier and maybe they didn't?
Absolutely. I think rightfully so. People were fearful to come out, go to their doctor's appointments. But we have had patients that have had symptoms and have neglected care, and then have, unfortunately, some have suffered consequences leading to emergent procedures when probably they could have been prevented in the first place.
And this can be serious. It can lead to serious health complications if they don't seek care early on. You mentioned those symptoms. What are things that patients need to, or people need to look out for within themselves that say, you need to get this checked out?
Yeah, absolutely. You know, routine, typical symptoms you would think about the heart, for example, chest pain or pressure, shortness of breath, dizziness, passing out, leg swelling, or even gasping for air in the middle of the night. You know, those are common cardiovascular complaints that we see, and if you're having any of those symptoms, you certainly should seek attention from your doctor and possibly a cardiologist.
Yeah, and I want to ask more about those symptoms, because you mentioned shortness of breath and passing out and things, but some of these I'm thinking people, they could mimic coronavirus, maybe I'm thinking about the respiratory area and some trouble breathing. Is there any way to differentiate between, okay, this could be a health challenge, or heart challenge here, or something along the lines that relates to coronavirus?
Yeah, that's a great question. I mean, I think with coronavirus, there's other host of what we say constitutional symptoms. So you'd probably have fevers, chills, sweats, and we know that there are other symptoms related. So in any event, I mean, you'd still want to seek an opinion from a doctor. If you're not having a fever, and especially if you have prior conditions that could predispose you to heart disease, for example, high blood pressure, cholesterol, etc., you know, your symptoms may be more solely due to your heart rather than possibly an infection.
Sure. Okay. So what types of exams or screenings are available for patients?
Yeah, so routine things that you expect from a doctor. For example, just going to the doctor and getting a physical exam, which can actually offer a lot of insight and information. But we also have heart ultrasounds available, EKGs, stress tests, other types of heart monitors to look at your heart rhythm.
Sure.
And then, if needed, more invasive exams.
Yeah. What can people do at home to ensure heart health during this time?
Exactly. I think they should practice healthy lifestyle habits, something that they should do, you know, throughout their life, regardless of this pandemic. I think that would include a healthy diet. What I mean by that is you want to try to focus as much on whole foods. So that would be a lot more whole plant foods, minimize processed food, especially processed meats and processed carbohydrates. You also want to make sure you're getting in regular exercise. What we do recommend is moderate physical activity most days of the week. So that would be at least 30 minutes of moderate level activity. You could also just walk. There's a lot of benefits to just walking, you know, anywhere from 7,000 to 10,000 steps per day. If you're not anywhere near that right now, just build it up slowly. Yeah. And you'll see tremendous health benefits.
Doctor, all things we've heard before, but sometimes it helps to have someone give us a nudge or hold us accountable. Where can people go for more information? Obviously, check in with your doctor, your medical provider, if you have any concerns.
Yeah, I think that's probably a great resource. We probably have some resource on our website at Rochester Regional as well, but I think speaking to your primary care doctor and your cardiologist is probably the best source of information.
All right. But don't delay seeking medical care. Dr. Sharma, thank you so much for your time this morning. Weather, local headlines coming up next.